a member of the full committee, the gentlewoman from New York. And we're very grateful to you, Congresswoman Clarke, for HR 2007, named for our late colleague, Stephanie Tubbs Jones. So it's a pleasure to have you with us. You can wave on to this subcommittee anytime you'd like. You're recognized for 5 minutes of questions.
And I thank you very much, Madam Chair, for including a piece of legislation in this hearing that not only holds great personal significance to me, but is especially important during a time where women's basic reproductive rights are under attack. Let me thank the witnesses. This has been a fascinating hearing and has really driven home the challenges we face as a multi-ethnic, multi-racial, multi-religious society. My legislation, HR 2007, the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act, is named in tribute to our dear colleague, friend, mentor, the late great honorable Congresswoman Stephanie Tubbs Jones. We know that during her tenure in Congress, this legislation was one of her top priorities. As Black women are disproportionately impacted by uterine fibroids more than any other women, and she would often say, has been stated by our witness, that Black women deserve better. And myself personally, living through my own challenges with uterine fibroids, I think oftentimes about the millions of marginalized women who possess little to no means for treatment and cannot access any solutions for their pain and suffering, and their suffering in silence. For my colleagues who may not be as in tuned, uterine fibroids are non-cancerous growths on the uterus and are among the country's most common gynecological conditions. About 26 million women and girls in the United States between the ages of 15 and 50 have fibroids, with more than 15 million experiencing what is classified as severe symptoms. And no group of women suffer more from fibroids than Black women, who are at an increased risk compared to their white counterparts to get fibroids at a younger age and suffer with more severe symptoms. It is estimated that fibroids cost the healthcare system between $5.9 billion to $34.4 million each year in productivity. This issue has not received the attention nor the funding it deserves. And increasing awareness on uterine fibroids is critical to our efforts to address the national maternal mortality crisis and prevent pregnancy-related deaths. We must allocate funding towards research and education so that those being impacted are receiving the proper care that they deserve. But in doing so, we can close the gap on this glaring disparity that has been disproportionately borne out in the lives of Black women. Lastly, I'd like to thank and recognize the work of the Fibroids Foundation, the White Dress Project, and other organizations and individuals that continuously and tirelessly advocate and create awareness about this condition. Let me say, Madam Chair, that it is critical that we look at the whole woman and the health care. These are the most important reproductive years in the lives of women, and to be afflicted with such a condition during that time is devastating in many ways, and dangerous in others. So I'd like to direct my first question to Ms. Tamika Gray Valbrun. Tamika, thank you for being here today and sharing with the committee your personal experiences with fibroids. Why do you believe we need to research and disseminate public information on fibroids?
Thank you so much, Congresswoman, for your advocacy and for sharing your story. It is imperative that we collect data and research so that we can know what is happening with this condition. On a very base level, there is so much information that we still don't know for the general public. A lot of women still don't know that a lot of times the symptoms they are experiencing are as a result of uterine fibroids. So for this condition, there are just base definitions and clinical studies that need to be done so that we are aware of what is happening with this condition, and really that we can educate people. There's really
And
just a
could
lot
you
of lack of
and
awareness.
could you elaborate on how disruptive uterine fibroids can be to a woman's overall workplace performance and quality of life?
Yes, absolutely. Quality of life is one of the biggest symptoms. The impact on quality of life is one of the biggest symptoms of uterine fibroids. Taking multiple days off work, not feeling comfortable, having stains and embarrassment, as I spoke about in my testimony. So it really is something that is daunting and that many women have to think about when they think of their social life, when they think of the jobs they're going to get. Even standing up from a chair can be a crucial part in a woman's life when she's dealing with fibroids. So it's
Thank you. I've run out of time. I
Yes.
appreciate it. Madam Chair, I yield back. Thank you.
The